Understanding Peripheral Nerve Injuries. The video is created by Dr. Abhinav Gupta and team. This video will act as a comprehensive guide for the topic peripheral nerve injuries. Peripheral nerve injuries refer to damage or dysfunction of nerves that are outside the brain and spinal cord. These injuries can result from trauma, compression, or various medical conditions. Peripheral nerve injuries are classified using the Seddon and Sunderland classifications. 1. Seddon classification: neuropraxia, temporary conduction block without structural damage. Axonotmesis, axonal damage with intact connective tissue framework. Neurotmesis, complete disruption of the nerve, including the connective tissue. 2. Sunderland classification: first degree, local conduction block, similar to neuropraxia. Second degree, axonal disruption with endoneurial tube intact, similar to axonotmesis. Third degree, axonal and endoneurial tube disruption, with perineurium intact. Fourth degree, axonal, endoneurial tube, and perineurium disruption, with epineurium intact. Fifth degree, complete nerve transection, similar to neurotmesis. Peripheral nerve injuries can result from various causes. 1. Trauma, accidents, falls, fractures, or direct injuries. 2. Compression, prolonged pressure on nerves. 3. Stretch injuries, nerves can be stretched beyond their normal capacity, causing damage. 4. Tumors, benign or malignant tumors can compress or infiltrate peripheral nerves. 5. Inflammation, conditions like Guillain-Barré syndrome involve the immune system attacking peripheral nerves. 6. Metabolic disorders, diabetes and other metabolic conditions. 7. Infections, certain infections, like herpes zoster or Lyme disease. 8. Exposure to certain chemicals or toxins may damage nerves. Types. Primary peripheral nerve injuries. Direct damage to the nerve tissue. Includes neuropraxia, axonotmesis, and neurotmesis. Results from trauma, compression, or stretching. Secondary peripheral nerve injuries. Indirect consequences following the primary injury. Inflammation, ischemia, and the formation of scar tissue. Contribute to nerve dysfunction and impact recovery. Primary injuries require specific interventions, while managing secondary factors aims to minimize additional damage and promote optimal healing. Peripheral nerve injuries are often named based on the specific nerve affected or the region of the body involved. Some examples include: 1. Carpal tunnel syndrome, compression of the median nerve at the wrist. 2. Radial nerve palsy, injury to the radial nerve, leading to weakness or paralysis of the forearm and hand. 3. Ulnar nerve entrapment, compression or entrapment of the ulnar nerve, causing symptoms in the hand and fingers. 4. Sciatic nerve injury, often associated with lower back or hip trauma. 5. Brachial plexus injury, damage to the network of nerves controlling the arm and hand. 6. Peroneal nerve palsy, injury to the peroneal nerve, affecting foot and ankle movement. 7. Femoral nerve injury, affecting the femoral nerve, which controls thigh muscles and sensation. 8. Facial nerve palsy, paralysis or weakness of the facial muscles due to facial nerve damage. 9. Axillary nerve injury, leading to weakness in shoulder abduction. 10. Tibial nerve dysfunction, damage to the tibial nerve, causing issues with foot and ankle movement. These names help identify the specific nerve or region affected, guiding healthcare professionals in diagnosis and treatment. Clinical diagnosis. Key steps include: 1. Medical history, understanding the circumstances of the injury. Identifying symptoms such as pain, weakness, numbness, or tingling. 2. Physical examination, assessing muscle strength, reflexes, and sensation in the affected area. Identifying specific patterns of weakness or sensory loss. 3. Nerve conduction studies, NCS, and electromyography, EMG. NCS measures the speed and strength of electrical signals along nerves. EMG assesses the electrical activity of muscles. Helps determine the type and severity of nerve damage. 4. Imaging studies. MRI or CT scans can identify structural issues like tumors or herniated discs. Useful for visualizing the anatomy around the nerves. 5. Ultrasound can be used to assess nerve compression, inflammation, or structural abnormalities. 6. Blood tests help rule out systemic conditions like diabetes or vitamin deficiencies. 7. Clinical evaluation by specialists. Neurologists, orthopedic surgeons, or specialists in physical medicine may provide further insight. Physiotherapy assessments for peripheral nerve injuries typically include 1. History taking, including details about the injury, symptoms, and any previous treatments. 2. Physical examination, assessing muscle strength, joint range of motion, and sensation in the affected area. Identifying specific patterns of weakness or sensory loss. 3. Nerve function tests, conducting specific tests to evaluate nerve function, such as nerve palpation, Tinel's sign, and Fallon's test. 4. Functional assessment, evaluating how the injury impacts daily activities and functional abilities. 5. Gait analysis, identify abnormalities related to nerve dysfunction. 6. Pain assessment, understanding the nature and intensity of pain associated with the nerve injury. 7. Joint and soft tissue assessment, examining the condition of joints, muscles, and soft tissues around the affected area. 8. Electrophysiological assessment, collaborating with healthcare providers to incorporate results from nerve conduction studies and electromyography. 9. Patient education, providing information about the nature of the nerve injury, expected recovery, and the importance of exercises and rehabilitation. 10. Baseline measurements, establishing baseline measurements for strength, range of motion, and other relevant parameters to track progress during rehabilitation. Physiotherapy management of peripheral nerve injuries aims to promote recovery, restore function, and minimize complications. It typically involves 1. Range of motion exercises, gentle exercises to maintain or improve joint flexibility and prevent contractures. 2. Strengthening exercises, targeting specific muscles affected by the nerve injury to regain strength. 3. Sensory re-education, techniques to improve or retrain sensory perception in the affected area. 4. Neuromuscular re-education, training the nervous system to control and coordinate movement, enhancing motor skills. 5. Modalities, using heat or cold therapy to manage pain and inflammation. Electrical stimulation, e.g., TENS, for pain relief or to stimulate muscle contraction. 6. Manual therapy, hands-on techniques like massage and joint mobilizations to improve tissue mobility. 7. Orthotic devices, recommending splints or braces to support and protect the affected area during recovery. 8. Functional training, incorporating activities that mimic daily tasks to enhance practical function. 9. Progressive loading, gradually increasing the intensity of exercises and activities as the patient's tolerance improves. 10. Patient education, providing information on self-management, home exercises, and strategies to prevent further injury. 11. Adaptive equipment, introducing tools or devices to compensate for functional limitations. 12. Monitoring and adjusting the treatment plan, regularly assessing progress and modifying the treatment plan accordingly. Complications. Complications of peripheral nerve injuries can vary depending on the severity and location of the injury. 1. Loss of sensation, can lead to partial or complete loss of sensation in the affected area. 2. Muscle weakness or paralysis, damage to motor nerves can result in muscle weakness or paralysis. 3. Chronic pain, some individuals may experience persistent pain, which can be neuropathic. 4. Muscle atrophy, lack of nerve stimulation to muscles may cause them to shrink and weaken. 5. Joint stiffness or contractures, reduced movement in the affected area. 6. Loss of coordination. Nerve injuries may affect coordination and fine motor skills. 7. Autonomic dysfunction. Damage to autonomic nerves can result in issues like changes in blood pressure, heart rate, or sweating. 8. Altered reflexes. Reflexes may be diminished or exaggerated depending on the nature of the nerve injury. 9. Psychological impact. Coping with the challenges of a nerve injury can lead to emotional and psychological issues. 10. Impaired daily function. Difficulty with daily activities and reduced quality of life. Prompt and appropriate management, including physiotherapy, medications, and in some cases, surgical intervention, can help minimize complications and enhance recovery. Vote of thanks. Thanks for watching our video. We hope this information has been valuable to you. If you have any questions or concerns, please consult our team for personalized advice.